Join our free NCLEX RN program today. Get free live classes, free bootcamp, mock tests, and 50% off OET training. Enroll today.
About one patient history, about like one patient's full history, like sign and symptoms, which medication he is taking, like this.
Okay, very good. So it means case study is something that you are in the clinical setting. For example, you are an ICU nurse or an emergency nurse. A patient has visited the emergency department or is admitted to an ICU. So you are a bedside nurse. You are a nurse in the healthcare setting, and now you have to decide which is the safe care for your patient. Okay, let me clear you one thing. NCLEX RN exam is always a safety exam. You always have to keep the patient safety your priority. Okay, always the safety. And you all know that how you will prioritize your patient. As we will move forward in this presentation, we will discuss that how you should prioritize your patient, what problems comes under as your first priority, what problems comes under your second priority, what problems can be your third priority, what problems can under as your fifth priority, and all these. Fine. Yes, Maria and Mariam Savera, you have raised the hand. Okay.
Ma'am,
So
I ask, sorry.
yes, you can ask. Yes.
As you ask about the case study, so in previous class we learned something from Sir Numan कि केस स्टडी में बेसिकली एक सिनेरियो बताया जाता है जिसमें पेशेंट की लैब्स या कोई सिनेरियो को जो है ना प्रॉपर्ली हिस्ट्री के थ्रू बताया जाता है और हम उससे रिलेट करते हैं there are type of questions which he told us which is present in that history. सो उसके
Yes.
अकॉर्डिंग जो है ना हम उसको फाइंड आउट करते हैं तो केस स्टडी बेसिकली एक सिनेरियो बेस्ड स्टडी होती है एक पर्टिकुलर सिचुएशन के लिए जो कि एक पेशेंट का केस दिया जाता है उस टाइम पर और उसी के अकॉर्डिंगली जो है ना आपने जैसे बताया कि सेफेस्ट और जो सेफ्टी है पेशेंट की वो हमारी प्रायोरिटी है.
Yes, Mariam, thank you so much. You are right. And what do you mean by the case studies? And case study is the huge percentage in your NCLEX RN exam. Okay, so let's start with that how you can crack your NCLEX RN exam, how you can crack your case studies, because this is a major portion in which you will get the confusion that how you have to um, decide what is best for your patient. Okay, for example, let's start. Have you all have the idea about the nursing process, that it has the five
Yes,
steps?
ma'am.
Yes. Okay, assessment, diagnosing, planning. So today we are going to discuss a model that will reciprocate with the or come parallel with the nursing process, and you will crack the case study. Okay, first of all, NGN case study format is just like thinking like a nurse, that you are in a clinical setting and now you are the one man army, and now you have to decide that what's happening with your patient. It can be according to a pathophysiology. They can ask you the question about the what labs or diagnostics would be preferable, what is the immediate intervention, what are the sign and symptoms, that they will assess your knowledge, your competence, as it will save your patient. Okay, first of all, uh, it is expected that at least each NCLEX RN exam would contain 3 full-length case studies, and each one case study contains the 6 questions. All clear?
Yes, ma'am.
Okay.
Yes,
So
ma'am.
okay, 6 questions and 3 case studies mean 18 questions. Okay, about 25% of your score are the case studies, additional clinical judgment or standalones. There are the different type of questions that you would encounter in the case studies. Almost there are probably 9 to 10 type of questions. And in the case study you will also encounter different type of question. They can be standalone, they can be the bow tie questions, they can be SATA question, and we will discuss it according to the case studies in upcoming classes and some of the questions in this case study. Okay, so first of all, we should know about what is clinical judgment measurement model. Whenever you are going to crack the case study, you have to answer these questions, you have to ask yourself about these steps. Okay, for example, you are making a nursing care plan, and whenever you make the nursing care plan, you have to follow the patient from assessment till end the evaluation. Okay, so now we're going to overlap our clinical judgment measurement model that is use your NCLEX RN exam. It would overlap with your nursing process. Okay, recognize the quiz. What do you mean by recognize the quiz? That you are going to assess the patient, that what data is most specific, what data require the immediate intervention. And because it is very important, assessment is very important. When you are going to assess your patient, it would lead to unfolding the case further. If you are lacking in your assessment, then how you can make the diagnose, then how you can plan according to the need of the patient. So you should focus on each and every step, and you have to ask the question accordingly. Okay, next step is analyze the quiz. Now you have to analyze the data. It means you have to make the diagnosis. Third step in nursing process is planning, and in the clinical judgment measurement model is to prioritize the hypothesis. For example, my patient is showing the general sign and symptoms. Now I should know about the hallmark sign of each and every disease that will help me to differentiate between the different hypotheses. For example, my patient is presenting with the shortness of breath, my patient is presenting with the crackles, so my patient is presenting with all these general signs and symptoms. Now I have to differentiate between, now I have to prioritize that what can be the immediate problem. Okay, either this is the heart failure, either this is the respiratory failure, or it can be another disease. Because once you have selected your answer in first question and you move to another question, you have no option to move backward and correct your answer. Okay, you have only one chance to select your answer and then move on to forward question. Okay, then first is prioritize hypothesis, second is generate solution. On the basis of that hypothesis, that for example, I have selected on the basis of sign and symptom that my patient has heart failure. Then what can be the solutions? What is immediate solution? If your patient is with the heart failure or your patient is with the fluid overload, so what is your priority immediately to tackle the problem of your patient, to ease the problem of your patient? Not that we are talking about what will be the long term management, what would be the, what you are going to take the second step, third step. We are going to talk about the first step, generate solutions. Okay, then take action. On the basis of that solution, I have to take the action, I have to carry the nursing intervention. Please wait 1 or 2 minutes. Okay. Then next or sixth step is evaluate the outcomes. Now I have to evaluate either my solution is right for the patient, and this is the end of the case study. At the end of the case study, most probably you should know about that either you have selected the right answers or either you have selected the wrong answers. Okay, then it will create the pressure on you. If you have selected all the right answer, then it has a positive impact on your exam. And if you have the wrong selected the wrong answers and you get the query about it, then it would impact negatively your exam. Okay, so you have to select each and every question very very judiciously, that it would impact your scores, it would impact your pass or fail rate or your success to be an NCLEX RN. Okay, so you should know how much time you would have for the NCLEX RN exam. Everyone has the idea about it?
Yes, ma'am. Around 5 hours.
Yes, and this is the huge amount of time that you can think it clinically, critically, and you have to select your answer. Okay, there is no time shortage. You have to select your answer very judiciously, very practically, and it should be your strategy when you are going to read any system. It can be gastroenterology, it can be cardiology, it can be maternal health nursing. You have to compare the findings, you have to highlight the differentiating signs. Okay, always make the table. For example, there are two disorders that are overlapping and there are some hallmark signs. You have to highlight those hallmark signs that will help you out in your NCLEX RN exam. Okay, this was the clinical judgment measurement model on which your whole case study is dependent. Okay, all clear?
Yes.
Hi, ma'am.
Yes, ma'am.
Ma'am, actually,
Okay,
I just joined the class. Can you please tell me from the start?
Reena Kamal.
Yes, ma'am.
Okay, we are moving forward, but we will discuss at the end of the class that what in chunks or will summarize the lecture.
Yeah, okay, ma'am. Fine. Thank you.
You're welcome. Okay, so first step is recognize the quiz. Please mute your mic. Okay, so what is most important? Whenever you are going to, we are going to elaborate it according to the questions, or we will, inshallah, discuss it according to the example. And I hope this would be a very productive lecture for all of you. That what's most important, what requires the immediate follow up, that all the sign and symptoms are present, that all the sign and symptoms are the uh, can be present in the disease, but what is your first priority? For example, if a patient came to the emergency department on an ICU, then what is your first priority? Well, your first priority is to maintain the blood pressure, your first priority is to maintain the airway of the patient, is your first priority is to maintain the oxygen saturation. So you have to decide according to the situation of the patient, and your clinical judgment measurement model would help you out in prioritizing it. Okay, what requires immediate follow up? Which findings are more concerning? Consider which are unexpected abnormals. How would I follow? For example, if your patient has the blood pressure of 150 or 90 and oxygen saturation of 85%, then what is your first priority?
To provide the oxygen.
Then,
Okay, very
according
good.
to
Provide the
Maslow,
oxygen.
ABC, first we need to check the airway, then breathing, then the circulation.
Okay, but both the things are abnormal. Now, what you have to decide? I have to decide which is the most concerning. We will move toward the Maslow's hierarchy for the prioritization, but here we are talking about which are unexpected abnormals, that which finding you should have to tackle immediately. Okay, what's the priority problem here? Revisit with every update. If your patient has case study has mentioned, case notes has mentioned that your patient has cough, your patient has crackles, your patient has blah blah blah, all these signs and symptoms. So what's your priority? All things are abnormal. Now you have to choose between the abnormal. It can be easy to choose abnormal from the normal, but to choose between the abnormals, to choose the immediate things that require the follow up. Okay, so first question is about recognize the quiz. Yes. Is this question visible to all of you?
नो मैम,
Why?
बहुत छोटा छोटा लिखा हुआ है।
जूम कर लें।
जूम करने से आ रहा है।
Okay.
जी ओके।
Okay. So, first of all, the following scenario applies to the next six items. Okay, they will give you the scenario, and case studies are also known as the unfolding case studies. Why unfolding? That they will give you chunks of information. For example, a patient came to the emergency department. First of all, we check patient's blood pressure, we take the history, we connect her to the or him to the saturation probe. So these are the vital signs. Then next step is we send the lab values. It will provide us with more data, then we can do the further investigation. It can be x-ray, it can be MRI. So this is the unfolding case study according to the time. Okay, so first of all we have to discuss about the first question. Okay, the client comes to the inpatient psychiatric facility for an evaluation, right?
Yes, ma'am.
Okay, the client is having distressing nightmares, flashbacks, and feelings of being on edge since a severe motor vehicle collision 6 months ago that resulted in the death of the client's sibling. Okay, the client blames self for the sibling's death and verbalizes feeling of guilt. Karish, please अपना mic mute करें. Please, it's request to everyone. Don't interrupt other students. Please mute your mics and only unmute whenever it's needed. Okay. Then the client reports an inability to sleep well and being quick to anger, both of which led to job loss and the client seeking help. Now, these all case notes are important. That patient is in the guilt, that patient reports inability to sleep well and being quick to anger, both of which led to job loss, and the client seeking help. The client reports a loss of interest in previously enjoyed activities such as working out and interacting with friends. The client has started smoking cigarettes daily since the accident and typically consumes four or more alcoholic beverages per day. This case study is very important, that when you are reading, please make the map in your mind that what's happening with the patient, that what sign and symptom the patient is experiencing. You have to filter the information. You have to make it parallel according to the disorders. Okay, okay. Then the client has started smoking cigarettes daily since the accident and typically consumes four or more alcoholic beverages per day. Mental status examination reveals an irritable, guarded, and easily distracted mood. The client's appearance is well kept and grooming and hygiene are appropriate. The client's speech is hyperverbal yet coherent and the thought process is organized. The client admits to feelings of hopelessness after the death of the sibling. The client reports occasionally seeing shadows but no visual hallucinations. The client has no homicidal ideations or history of violence toward others. Okay. Now I have to answer my first question according to this case history, according to these case notes. Okay. So today we are going to discuss that what can be the possibilities. Don't get disheartened by the difficulty level of the questions, because as well as you are getting exposed to the type of question, to the type of data, it would be more easy for all of you to crack the case studies, to crack your NCLEX RN exam, to differentiate between the sign and symptoms. So this is the whole case study, and now we're going to discuss about our first question, that what sign and symptoms are important. Okay. Which client finding require immediate follow-up by the nurse? Hopelessness, hyperverbal speech, insomnia, and irritability. Yes, according to the case notes, what is your priority?
Irritability.
Irritability. Okay.
Irritability.
Okay,
Irritability.
irritability. Okay. So when we're going, okay, four, when we will move towards the mental health nursing, then I will explain, or any other teacher would explain, that what are the hallmark sign, what is the most dangerous sign and symptom between all of them. Hopelessness. Whenever your patient is hopeless, he or she will commit the suicide. Okay, so safety is always priority. Hyperverbal speech can be the generalized sign and symptom. Insomnia can be the generalized sign and symptom. Irritability can be the generalized sign and symptom. But hopelessness is not the general sign and symptom. This is your priority. Patient has no hope. If your patient has no hope, it would lead to the depression. It would lead to the suicidal attempt. So immediate follow-up required is the hopelessness. All clear?
Yes, ma'am. It will be deep observation, hopelessness.
Yes.
And
Next is analyze. It means we now are going to make the diagnosis. Okay. What could it mean? What condition is the client experiencing or at risk for? Diagnosis mean either you can make the definitive diagnosis, or you can make the provisional diagnosis, or you can uh, mark the possibilities that it can be there can be one problem, there can be second problem, there can be third problem. Okay, what disease processes could cause these findings? There can be the question related to the pathophysiology of the patient. How could I know if X was happening? That how I should know that this can happen in my patient? The bigger picture problem, not the short story. You have to know about everything about the disease. Then now you can crack your question. Okay, specific versus non-specific problems. Okay, let's make it helpful through the case study. Okay, you all have you the idea about the history of the patient, that your patient uh, has going through flashbacks, nightmares. Your patient's sibling has been died in a motor vehicle collision 6 months ago. Your patient has a sense of guilt. Your patient has insomnia. Your patient has anger. Your patient has hopelessness. Okay, so this was the case scenario. On the basis of this scenario, now we are going to encounter the second question. The nurse suspects that the client experiencing post traumatic stress disorder. Which of the following symptoms are consistent with this condition? Select all that apply. There can be, you all know about the SATA question, that there can be the possibility only
Yes,
one
ma'am.
answer can be right, or six answers can be right. It
Multiple
would depend
answers
on
may
your
be right.
knowledge. Yes, it there can be one answer, two answers, three answers, four answers, five answers, six answers. Okay. The nurse suspects that the client is experiencing post traumatic stress disorder. Which of the following symptoms are consistent with this condition? Select all that apply. Yes. You can do the elimination strategy. Okay. First of all, we will discuss the first option, euphoric mood. Have you encountered anything in the patient history that your patient has euphoric mood? That your patient is happy, or your
ma'am,
patient has mania, your patient. Okay.
No, ma'am.
Okay, Sadia. Okay. So euphoric mood, it means so if you can recall about the post traumatic stress disorder does not involve the euphoric mood. It's always a depression. There is a depressed mood. In bipolar disorder, there can be the two things. It can be depression, it can be euphoria. But in the traumatic disorder, your patient would always be depressed. Okay, flashbacks. Flashback is the hallmark sign of
Yes, ma'am.
post traumatic stress disorder. Okay. Hypervigilance, that your patient is always going to filter his or her environment that something is going to happen, something is going to happen. If any patient has experienced a trauma, then it would be a sign and symptom in post traumatic stress disorder, hypervigilance. Your patient is always vigilant that there is something going to happen with him or her. They will filter the environment, they will not going to trust anybody. Okay.
Yes, ma'am.
Okay. Irritability, they will always be irritable. They are not going to cope with any situation. They will get frustrated on simple short things. So irritability is also nightmares, flashbacks and nightmares. This is also the hallmark sign of post traumatic stress disorder. Self blame, that this is happened due to
Yes,
me.
ma'am.
He is in loop,
Blaming, self
ma'am.
blame. Okay. So 2, 3, 4, 5, and 6 all are right answer except euphoric mode. All clear?
Yes, ma'am.
Okay. Next is 1 minute, please. Okay. Third step is prioritize the hypothesis. Okay. Slide visible?
Not madam.
Yes, ma'am.
No madam.
No, ma'am,
Slide
not
not
visible.
visible.
No.
Please refresh your pages. Slide is visible now.
Yes, ma'am, it's visible to me.
Thank you. Okay. So now you have to, third step is prioritize your hypothesis. Where do we start? What is the client most likely experiencing? What is the client at highest risk for? What do I need to do first? If you could do one thing and walk away, what should that one thing be? Okay. That if there is only possibility that you should or you can do only one thing, what would be your priority to save your patient? Okay. Now you have to prioritize the hypothesis. Okay, third question is the nurse is in inpatient mental health care unit, is caring for a 43-year-old client. History is same. Okay, till now history is same. Now we have to prioritize. Now we have to select according to the condition of the patient. Okay, please all mute your mics. Okay, so now third type of question is complete the following sentence or sentences by choosing the list or lists of the options. The nurse should prioritize the intervention for dash due to the risk of dash. Okay. In case study, you are going to click on the small arrow, then it would make these options visible to you. And now, for example, I want to select anxiety, then I would click on anxiety and it will get automatically selected in the bar. Okay. Now it means now you are going to make the diagnosis as in your nursing process, that this condition is related to this as evidenced by this. You all know about the nursing diagnosis. Okay. So
Yes,
now we're
ma'am.
going to prioritize. Okay, now we're going to prioritize it and we are going to give the reason that why this happening with my patient. The nurse should prioritize the interventions for dash. Now first we have to we're going to solve the first clause: anxiety, irritability, alcohol withdrawal, or complicated grieving. You should know about the scenario, that what's happening. All this started where from the death of the sibling. Then now what is the intervention, and for
Ma'am,
the what
anxiety.
reason? Okay, Manaza, I will explain it. Other possibility, please think
Complicated
about it.
grief.
Yes, please. सेकंड अभी किसी ने आंसर किया था.
Complicated grieving,
Ma'am,
ma'am.
complicated grieving.
Very good.
Complicated grieving.
Yes, your patient is unable to cope with the loss. Uncomplicated grieving. Clear?
Yes, ma'am.
Okay. Now
Yes,
we are
ma'am.
going to second fill in the blank. Due to the risk of, yes,
Self-harm. Self-harm. Yes.
due to the risk of self harm. Very good. Hopelessness. We have discussed in first um, slide or first question that hopelessness always leads to the suicidal attempt. Your patient can do the suicidal attempt. Your patient is at the risk of
Self-harm.
self harm. Yes, very good. So your panic attacks, no, panic attack is not leads to the this can be leads to flashbacks, no panic attack. Angry outburst, not angry delirium tremens. This also happens in alcohol withdrawal, benzodiazepine withdrawal. But here what is your priority? That what can be the reason? The reason is your patient can attempt the suicide, can do the self harm, because in the case notes we have read about it, that he has told it happened due to him, that all this happens due to him. Self blame, guilt, hopelessness, all these leads to the self harm. All clear? Now you have prioritized the hypothesis, you have the idea about that how you have to prioritize. Now I have to prioritize between self harm, panic attack, angry outburst, or delirium tremens. Clear? Okay.
Yes,
Yes,
ma'am.
ma'am.
Please guide me why anxiety is not correct.
Because anxiety can be correct. Now you have to prioritize. Is this the anxiety only? What is
No.
the background reason? That is uncompensated grieving.
Okay.
He is unable to accept that she or he has lost his sibling.
Yes.
Okay, that it was the fate. It was not. These were the circumstances. Okay. Next, generating solutions. What can I do? Which interventions are indicated or not indicated? Now we are moving to another type of question. They will give you option that are these interventions are required, are these actions are required or not required, appropriate or not appropriate. Which actions would worsen the priority problem? Which actions could address the priority problem? Depends on your understanding of the content. Okay. Then next is generating solutions. You all know that your patient's history is same, but they are asking you different type of questions in every slide. But this is, there can be the possibility then in with each question they will give you the more data, they will give you the vital sign, they will give you the data about the change in patient's condition, the lab values. Okay, so next step is generating solutions, and now we are going to discuss about what is appropriate and what is not appropriate. Visible?
Ma'am, will you
Question is
Yes,
please
visible?
ma'am.
zoom?
I have zoomed in.
Yes, ma'am.
Now, okay. So The nurse has reviewed the information from the nurse's notes. For each potential intervention, click to specify if potential intervention is appropriate or not appropriate for care of the client. Potential intervention, then appropriate or not appropriate. Okay. Provide the client privacy during flashbacks. Appropriate or not appropriate? Your patient has flashback.
Appropriate.
Appropriate. Okay. Who is saying that this is appropriate? Please explain it.
Because privacy is the right of the patient.
Okay. Safety is the right of the safety is not the right of the patient.
Uh, privacy is the right of the patient.
Okay. So you have
Ma'am,
to
if we
think
don't
about.
provide the privacy,
Okay. Please explain.
ma'am,
In this type of patient, if we don't provide privacy, they do not give us more information uh, for the gathering data.
Okay. Here your patient is undergoing through the flashback. And during the flashback or it can lead to further complication. If you will leave the patient alone, it can lead to more harm and your safety is priority. So when your patient is under the flashback, never give him the privacy, never leave him or her alone, because it would complicate her or his safety.
Maybe
Think like
harm
a nurse.
himself.
Yes. So that is the most vulnerable period, flashback. So what you have to do in this acute
I got
phase?
it wrong.
This is
Excuse me,
important.
ma'am, your screen is not clear.
Screen is not clear to all of you?
No, ma'am.
It is visible. Yes, ma'am, now it's visible. Yes.
Okay. Please check your internet connectivity. It also impact the screen because it's visible from my side. Okay. It will impact the quality. Okay. Now help the client identify available support system. Is this appropriate or not appropriate?
Appropriate, ma'am.
Very good. This is appropriate.
Appropriate, ma'am.
Yes. Yes. Okay. Next is directly ask if the client is having thoughts of self harm. This is important that you have to ask your patient that either he or she is feeling about the self harm to do a self harm.
Yes,
Okay.
Yes,
This is
ma'am.
also
Yes.
appropriate. Okay. Assess the client's ability to perform activities of daily living. For example, you are depressed, you are anxious about something, then it would impact your activities of daily living or not?
It will impact.
yes,
Exactly,
that's
ma'am. It
right.
impacted on our daily living.
Okay, so we
Yes.
this is appropriate. Assess the client's ability to perform the activities of daily living. Okay. Teach the
Yes,
client
ma'am,
to
it's
use
appropriate.
okay. Teach the client to use progressive muscle relaxation for anxiety. Your patient is also experiencing the
Yes,
anxiety that I
ma'am.
have already cleared to all of you. So this is important. Muscle relaxation for anxiety. You have to teach your patient, you have to educate your patient about it. Okay.
Yes, ma'am.
Okay. Then
Yes, ma'am. This is also
next is uh,
मैम ये
okay.
appropriate होगा कि not appropriate ये teach the client to
Appropriate.
use
Appropriate होगा. Appropriate.
It will be appropriate.
मैम
Munazza,
मतलब मीन्स इसका इसका यही मतलब है
it's
कि आप पेशेंट से कहेंगे मतलब कि हमसे कोई मसल रिलैक्सेंट एडवाइस करेंगे
no, no,
एंजाइटी
no,
के
no.
ये जरा मैम
कि
इसको
उनको
क्लियर कर
कैसे
दें
यूज करना है.
अच्छा
For
मसल्स को कैसे
example, I
यूज
will नहीं नहीं फॉर एग्जाम्पल मुनज्जा मैं आपको बताती हूँ that how you can do the muscle relaxation exercise, how you can do the deep breathing, how you can
Like
use your
you,
muscle rest.
you can exercise and remove your
Yes, ma'am.
anxiety.
Teach the patient now how
Yes,
they can relax.
Like
yes,
some
muscle
cognitive behavior
relaxation.
therapies.
Yoga,
Yes.
long,
ओके ओके मैडम
deep breathing.
थैंक यू
Okay,
ओके
okay, okay.
क्लियर
So
थैंक यू
next is avoid discussion of the traumatic event when speaking to the client. Is this appropriate?
Appropriate.
Yes, ma'am. It's not
Please,
appropriate.
Yes,
No,
ma'am.
ma'am.
No, ma'am.
No,
Appropriate.
madam, it's not
please raise,
appropriate.
please.
He's already PTSD patient.
It's a request or it's an order, whatever you would take it. Please raise your hands. Everyone is going to answer the question, then how it will be possible that any other student who is silent or who is listening can understand that what's going on, what is happening, what is right answer, what is wrong answer, what is the reason behind it. Okay, so please raise your hand. I will call your name and you can explain your reason. So what is the right answer? Not appropriate. First of all, you always have to talk about the thing. You can solve the problem only if you accept that there is a problem. Okay, you can solve only the problem if you think that this is the problem, that there is a problem. So if you avoid discussion of the traumatic event, then how is it possible to solve the problem? If you are not going to talk about that there is an existence of problem, then how the patient is going to cope with this? It will lead to further hopelessness, it will lead to further self harm, it can lead to further self blame. So you have to talk about more and more about the problem, and you have to encourage the patient to express the feelings. Is this right?
Yes, ma'am.
Okay.
No, ma'am.
Why no?
Sorry, मैम मैंने ये आंसर
Okay,
देना था यस.
okay, no problem. Okay, next is fifth step, taking action. What will I do? Should I? How do I? So this is your priority. You have to follow the Maslow's hierarchy model. That is your uh, physical needs, physiological needs, psychological needs, all these things. But now we're going to discuss it according to ABCD. First of all, in first zone, your basic is always the airway. For example, they have given you three options, that your patient has airway problem, your patient has a breathing problem, your patient has a circulation or blood pressure problem. You always have to always select the airway. Okay,
Airway.
if they give you the three scenarios, one, your patient has airway problem, in second scenario your patient has breathing problem, in third scenario your patient has circulation problem. Now how you have to prioritize it? You have to prioritize it according to the
Condition.
ABCD. Okay, fourth is disability, there can be any neurological sign and symptoms. And in the fifth, there can be any routine task, there can be expected finding, there can be psychological needs. But psychological needs doesn't mean that your patient is going to perform the suicide and you are thinking about this is the psychological need. No, this is not the psychological need. This is the safety, this is a basic need. Your patient is going to attempt the suicide, so this is also your priority. So safety is always priority in whichever situation this is. Okay, psychological needs mean that I am depressed, I am anxious, I need a CBT, I need a counseling session. So that can be the psychological needs. That can happen in some other time. But what is your priority? This is according to that.
Airway.
Okay. Next is taking action. Scenario is same. Now we are going to select according again that type of question. The nurse has reviewed the information from the nurse's notes. Complete the following sentence or sentences by choosing from the list or list of options. During the acute phase of a panic attack, the nurse should stay with the client, give the client privacy, discuss anxiety trigger. If you have already grabbed the situation or grabbed the discussion, then yes, Hurev.
Ma'am, you just shared the prioritization list. It's the part of priority hypothesis or it's separate from that?
Sorry, please ask again.
You just shared the prioritization list from A,
Yes.
B, C, D. So is it a
Yes.
part of priority hypothesis or is it different?
No, this is a part of case study that whenever you're going to, this can be in case study, there can be a type of question of prioritization is a very important topic. Okay, you can do it according to in any situation that there are scenarios in which you are unable to tackle the situation, that how you would prioritize it, then you would have to prioritize it according to the Maslow's hierarchy in every question. It can be
Okay,
related to
so
case study.
it's general basically for every
Yes,
question,
it
not the part
yes,
of
yes,
clinical judgment measurement model.
yes.
Okay. Thank you.
You're welcome. Okay, so next is complete following sentence or sentences by choosing from the list or list of options. During the acute phase of a panic attack, the nurse should stay with the client, give the client privacy, or discuss anxiety triggers. Yes, please. Yes, Mano.
Stay with the client.
Stay with
Madam,
the
stay with
patient.
the client.
Very good. It means you all have understood about it. And why? What is the reason that you have to stay with the client?
Safety first.
Very good. Now you have to select from the hypothesis, you have to select from the options. Please raise your hand. Yes, Aisha. Yes, Aisha, please answer.
Ma'am,
Ma'am,
reassure that the client is in a safe place.
ma'am, reassure that the client in a safe place.
Very good, Aisha. Reassure that the client is in a safe place. Why you have not to teach the client signs of increasing anxiety? Because teaching can happen in any other time. Acute phase. During the acute phase, your patient has the reduced attention span. This is not the right time to do the teaching. That your patient is going through something, a panic attack or some flashback, and now you're going to teach the patient. No, you can teach him or her that at another time, that if you have encountered it again, what you have to do. Okay, so give the client a phone to call a support person. Is patient in his or her senses during a panic attack that she or he can make a call to a support person? No, you are the support person at that time. Okay, clear to all of you?
Yes,
Yes,
ma'am. Yes,
ma'am.
ma'am.
Okay. Next is evaluate the outcomes. Did it help? Was it effective? What signs would indicate a complication? So next and last question is uh, this: the nurse is caring for the client 7 days after admission. For each of statements made by the client, click to specify whether the statement indicates the client's status has improved or not improved. I woke up once last night. Yes, improved or not improved.
Improved, ma'am.
Very good. This is the benefit of education or benefit of case study, that at the end of the uh, case study you can understand what is right and what is wrong, if you have selected it from the very first step right. Okay, so I want, why it's improved, because if you memorize about or you remember about the history, that patient has reported that he or she is unable to sleep.
Unable to sleep.
Yes. So now I woke up only once last night. This is improved status.
नहीं नजर आ रही.
सबके साथ यही प्रॉब्लम है, सबको स्क्रीन नजर नहीं आ रही.
क्लियर है मैम. नो मैम आ रही है.
Visible है madam.
Please check your internet connectivity. Okay, I want to talk about the nightmare I had. Improved or not improved? वो बात करना चाह रहा है उस बारे में, ही और शी। अब आपकी उसकी सिचुएशन है, वो अपनी फीलिंग्स को एक्सप्रेस करना चाह रहा है। इज दिस इम्प्रूव्ड और नॉट इम्प्रूव्ड?
Improved, ma'am. Improved, ma'am.
Yes, this is improved situation. I am thinking about selling my car and taking the bus instead. Improved or not improved?
Not improved.
Very good.
Not
This is a
improved.
very tricky one because still in his mind is that it happened because of
Again
this.
and
Yes. Next, I have been journaling my stressors and emotional reaction to those. Is this improved or not improved? What do you mean by journaling? For example, I am going to assess about or write about something that is going to um, trigger emotional reaction. Okay, I will explain the third option. Okay, I have been journaling my stressors and emotional reaction. It means the patient is now going to um, assess that where the problem lies. What is the problem? Okay, it means whenever a person acknowledge the problem, it means we can generate a solution. If anyone is not going to acknowledge the problem, then how you can give him or her a solution? Okay, so this is the improved.
he wants to cope up with the stressors he had in her past.
Hello, my voice is audible?
Yes, ma'am.
Yes,
मैम
ma'am.
Yes,
अभी
Mulad.
आई है आवाज आपकी।
Yes, अभी ही बोली हूँ मैं। इंटरनेट मेरा कनेक्शन लॉस्ट हो गया था फॉर अ मोमेंट। Okay, sometimes I still get upset by small issues, but I control my feelings better now. This is improved or not improved? Yes. Okay, third
Improved.
option is okay. Third option is I am thinking about selling my car and taking the bus instead. Yes. कौन explain करेगा इसको?
Ma'am,
Yes, please.
because he is not coping up with the past event.
Very good. So it means not improved. That
Yes,
he or
ma'am.
she is still blaming the situation. Because, please
Yes.
memorize the key that motor vehicle collision accident leads to the death of
Accident.
his sibling.
So,
Okay, clear? Third option
yes,
is clear?
ma'am.
Okay.
Yes,
So
ma'am. Yes, ma'am.
okay, so this was the case study, and these were the tips according to which we can crack each and every question we will encounter, and there can be the different type of questions in different case studies. I hope it would be a productive session for all of you. And if anyone has a question related to these case studies, please let me know.
अस्सलाम वालेकुम मैम।
Walaikum assalam.
अफीरा बात कर रही हूँ। सॉरी, मैं मेरा कनेक्शन इशू था, मैं नहीं थी ज्वाइन कर सकी। अभी फर्स्ट टाइम ही मेरी क्लास ज्वाइन हुई है। इंट्रोडक्शन क्लास भी मैं जो है वो ज्वाइन नहीं कर सकी थी। तो आई जस्ट वांटेड टू आस्क कि आज आपने क्या पढ़ा, थोड़ा सा उसको बस समराइज कर दें और मैं फिर रिकॉर्डिंग पे गो थ्रू कर लूंगी। और बुक का
Okay.
रेफरेंस दे दें कि हम लोग कौन सी बुक जो है वो यूज कर रहे हैं। वही जो सॉन्डर्स की हमें शेयर हुई थी स्क्रीनशॉट,
Yes,
देखो
Safira.
उसी की जो रिव्यू बुक है वो वाली हमने पढ़नी है फॉर द रिव्यू और क्वेश्चंस के लिए। किस बुक को हमने रेफर करना है?
आप क्वेश्चंस के लिए तो एलएमएस करेंगी ना अफीरा?
ठीक हो गया।
ठीक है। और इसके अलावा जो भी आज हमने पढ़ा, थोड़ा सा मैं केस स्टडी को समराइज कर देती हूँ, बल्कि आपने अगर देखा है दैट देयर case studies are a huge part of the NCLEX RN exam, and you will encounter at least 3 case studies, but there can be the possibility there are some students of mine in NevTech program or PIF that they have told me they have encountered at least 5 case studies in one exam, or SATA questions and case studies. Select all that apply questions. Okay, so there can be the
Okay,
possibility that
that is
more than,
difficult.
yes,
Which one is more difficult to answer? I mean, multiple, when they are asking to put the multiple answers, or when they are asking to choose one answer.
Afira, it
Which one
depends
is
on your
easier?
understanding.
It's just a question. It depends on
No,
our understanding, how we
yes,
understand the question.
yes, how you are understanding the question and what is your command in your basic knowledge, that how you are, whenever you are going to organize the data anywhere or anything, you are going to organize your closet, is it easy to uh, take a cloth from the organized closet? So this is same with your brain, that if you are going to organize your data, if you are going to organize your thoughts, it would be easy to answer the question according to
But
that data.
what I have heard from the people who already got their NCLEX certification, like they will
Yes,
start with the simple questions, and once they know that you are able to answer those questions, and then they will go to the medium level, and then they will go to the
yes,
higher
Safira,
level,
yes,
and then
yes,
they
yes,
will put
yes.
you in a situation.
This is the possibility. uh, they will,
Okay.
they can give you the, there are some testing question, there can be some testing question, but you didn't know about either this is going to include in your exam or is this a testing question. I am telling you that there can be the possibility that you have encountered all the case studies. There are the different type of questions. For example, there are the passing level question, there are below passing level question, or there are above passing level questions. Okay, it will,
Wanted
the
to do.
computer,
We are very excited and we are desperate to do it because I'm already very late. So
no
inshallah,
problem.
we will be able to achieve after searching and trying to choose a platform. I think it was God decided that we will be connected with the global health. So inshallah, it's going to be a nice experience
Inshallah,
and
Fira,
we
and
will.
best of luck from my side to all of you. That it would be
Thank
a
you.
very successful journey for all of you, because it will take the money, it will take time, it will take your effort, all these things. But
Of course,
once you choose a platform, once you choose an opportunity, it means you are already in a race to crack it, inshallah.
inshallah.
Inshallah, ma'am.
Okay, so there can be the case studies, or there can be the different type of question. There can be a multiple response or SATA question, multiple response or select all that apply type
In
questions.
generally, we have to be ready for all the situations.
Yes,
We
it
must
depends on
have
your luck.
hands
It
on.
depends on your
Yes,
luck.
it depends on the luck. Sometimes knowledge is not enough.
Uh, but if you
Luck
are
is always
hardworking,
there.
but yes,
But once we work hard and God is there who is watching us, and for sure we will get reward of that. So inshallah, we
okay,
will be able to achieve.
okay, inshallah. Uh, yes, Mano,
मैम
please,
ये
if you
लेक्चर
have
फिर
any,
ये वाला भी रिकॉर्डेड ये
yes, I have
रिकॉर्डेड
recorded
लेक्चर्स
the
फिर
lecture.
हमें
Madam, the word you use, LMS, please brief it, explain it. What is it?
Oh, okay, okay, okay. Learning management system, learning module, that can be bootcamp, that can be UWorld, whatever it would be recommended by Sarvakas, in which you can
Thank
practice
you.
your
okay
exam.
ma'am sure
Okay. Any question from all of you related to the lecture or case study?
मैम लेक्चर और
Okay.
केस स्टडी तो आई joined in the middle so whenever the recorded lecture is going to be uploaded so we will get notified or should we remind for that because we
You
don't
will get
want to
an,
interrupt or disturb you.
okay, thank you. Afira, you will get an email that you have got the access Sir Vikas has shared a Google form in which you have to put up your
Yes, yes,
credentials.
we have to fill it. Okay,
Yes.
sure.
Okay. Okay. So let's end it.
We'll follow.
If you all have any question, then we will discuss it in the next class. Okay. Please
No
read it
problem.
and
Your good name, please.
Sabah Nazir.
Thank you so much. Nice to meet you.
Thank you
It
so
was my
much.
first class, actually.
Okay, no problem, Veera. I hope it would be a pleasant experience for all of you. Okay, now we're going
Inshallah,
to end the
inshallah.
class. Allah
Sure,
Hafiz.
Ma'am,
ma'am.
please, ma'am, please
Allah Hafiz,
explain
ma'am.
about the
Thank you for sharing.
sporting system.
Okay, ma'am.
Uh,
Allah Hafiz.
Hello,
Sorry, G, yes, please.
ma'am, please explain the sporting system taking action you have said.
No, Sadia, still we are going to discuss about all these things and we will conduct the exams on Google Forms. Okay? Learning management system is at the end of the uh, preparation that you are going to assess your abilities.
ओके मैम
Like
उन्होंने मैम
bootcamp.
स्पोर्टिंग सिस्टम में आपने जो है ना बताया था स्पोर्टिंग सिस्टम का पेशेंट का तो वो प्लीज एक्सप्लेन कर दें
Support system. Okay. Uh, about which question? Second or third or first? Sorry, Sadia, please again ask about it.
थर्ड टेकिंग एक्शन
Taking action. Okay. Give the client a phone to call a support person. If you are going through a situation, if you are have a flashback, or if a patient is experiencing any trauma, at that time he or she is able to make a call.
No, ma'am.
At that time, you are the support system of the patient. Okay, Sadia? Okay. Please. Allah Hafiz.
Okay, ma'am. Allah Hafiz.
Join our free NCLEX RN program today. Get free live classes, free bootcamp, mock tests, and 50% off OET training. Enroll today.